Welcome back to the deep dive. Today, we're really trying to cut through the noise and get straight to the heart of cardiovascular health and blood clotting. We want to give you those crucial insights you need, kind of fast. Our mission for this deep dive is basically to unpack a really fascinating collection of sources about how your heart and blood system actually work, and the really clever ways medicines step in when things aren't quite right.
That's right. We're going to sort of build your understanding from the ground up,
Yeah.
starting with how the heart pumps blood so efficiently and how your body naturally regulates blood pressure. Then we'll dive into how specific medications interact with these vital systems. And finally, we'll explore the incredibly intricate process of blood clotting and how we manage it when it goes awry.
And honestly, there are some truly surprising facts hidden in our sources today. You might be amazed, where some powerful heart medicines actually came from. And we're even going to try and demystify some of the, precise molecular mechanisms at play. Okay, let's unpack this. So let's start with the start of the show, the heart itself. When you picture it, maybe from a diagram, you're looking at this masterfully designed 4-chamber pump. It's amazing, really. Just imagine blood flowing in from your body, right through the big vena cava veins into the right atrium. Then it goes through the tricuspid valve into the right ventricle. From there, bam, it's pushed out through the pulmonary valve into the pulmonary artery, heading off to your lungs to grab some oxygen. Then that oxygen-rich blood comes back via the pulmonary veins, goes into the left atrium through the mitral valve, into the left ventricle, and then gets powerfully ejected through the aortic valve into the aorta. That's the body's main artery to go everywhere else. It's just this incredible continuous cycle. But sometimes, the system can face challenges like high blood pressure. And that's where certain medications can lend a hand.
Exactly. And one particularly interesting way to tackle high blood pressure is with what we call centrally acting agents.
Mm-hmm.
Their approach is pretty unique because they work directly on your brain. Let's take Methyldopa, for instance. This drug isn't actually active right out of the bottle. It's what we call a prodrug.
Okay, a prodrug. So it's like it needs to be activated inside the body first. Is that the idea? Tell us more about why that's clever.
Precisely. Yeah, think of it like this. Your body has to transform it, specifically in the brain, into its active form, which is alpha-methylnorepinephrine. This kind of ensures its power is, unleashed right there in the central nervous system, not just everywhere. Once it's active, its mechanism is, pretty smart. It essentially binds to specific receptors in the brain, alpha-2 adrenergic receptors. And it tells your brain to kind of calm down the signals that normally make your blood vessels constrict. It's like putting a gentle brake on your sympathetic nervous system. That's your fight or flight system. So the result is your blood vessels relax vasodilation, which reduces resistance to blood flow and ultimately lowers your arterial pressure. It's often chosen specifically for managing hypertension during pregnancy. Though it's important to know it's not used if you have liver disease. You'll usually find it as an injection or tablets. Another drug that works kind of similarly is Clonidine. It also acts on those central calming receptors, helping reduce those vasoconstrictor signals from the brain. It's also available in various strengths, injections, and tablets.
That sounds like a really powerful way to tap into the brain's control. But when you dial down that sympathetic nervous system, what kind of side effects might someone experience? Any ripple effects?
Yeah, you're right to ask that because these drugs dampen that central nervous system activity and reduce sympathetic outflow. Common side effects can include feeling, drowsy or sedated, maybe having a dry mouth. Some people might experience bradycardia, that's a slower heart rate, or orthostatic hypotension, that dizzy feeling when you stand up too quickly. That's basically your body's pressure regulation being a bit slow to catch up. Other effects can sometimes include impotence, constipation, maybe some nausea or general gastric upset. Now let's look at another category, direct-acting vasodilators. These drugs take a completely different path. They work directly on the blood vessels themselves. Take sodium nitroprusside, for instance. This is usually given intravenously in hospitals. Its mechanism is incredibly rapid. It quickly releases nitric oxide. That's a natural compound that's really potent and fast-acting vasodilator. It opens up both your veins and your arteries pretty much immediately. This immediate effect means a really quick drop in blood pressure, which makes it a critical tool in hypertensive emergencies, where you need to lower BP very fast.
But because it's so fast, you need careful monitoring. It can cause things like reflex tachycardia, where your heart speeds up trying to compensate, or even, dangerously low blood pressure if you're not careful. Then there's Hydralazine. This drug works by directly relaxing and widening your arteries. So it lowers resistance to blood flow and, consequently, your blood pressure. Like sodium nitroprusside, its adverse effects can include that reflex tachycardia and also sodium retention, which might lead to fluid buildup. It's also been known, interestingly, to sometimes cause hirsutism, which is increased hair growth. Hydralazine is usually taken orally, so its onset is slower. And it's often combined with, say, a beta blocker and a diuretic to manage those side effects and really maximize its blood pressure lowering effect. It comes as injections or pills, too.
Okay, so we've looked at how we can fine-tune the body's internal pressure gauge. Really interesting stuff. But what happens when the heart itself, that amazing pump we talked about, needs a bit more, well, or maybe a steadier rhythm? That's where a truly remarkable class of medications comes in, and they have a pretty surprising backstory, right? Cardiac glycosides.
That's a perfect segue. Yeah, what's really fascinating here is that these powerful compounds like digoxin and digitoxin originally came from plants. Historically, they were extracted from the foxglove plant, Digitalis purpurea, and its relative, Digitalis lanata. And even the yellow oleander, Cascabella thevetia. It's pretty amazing when you think about it, how people way before modern pharmacology discovered these incredibly potent medicines just, directly from nature. These drugs essentially act as direct helpers for the heart, and their dual action is what makes them so valuable. First, they significantly enhance the force of contraction of the heart muscle. We call this ionotropic activity, basically making each beat stronger. This is super crucial for conditions like congestive heart failure or CHF, where the heart muscle has weakened and isn't pumping blood efficiently enough. Second, they also slow the heart rate, and that's particularly useful in managing certain irregular heart rhythms, like atrial fibrillation.
Wow. Okay, so they're doing two really important jobs at once, but what's the actual how? Like, how do they manage that inside the heart cells themselves?
Yeah, the mechanism is quite elegant, actually, pretty precise. Imagine your heart cells have these tiny pumps, often called the sodium pump or NEC-adenosine triphosphatase. They're constantly working to push sodium out of the cell. Cardiac glycosides essentially inhibit or slow down this pump. They kind of block it up a bit. So when the sodium pump is slowed, more sodium starts to build up inside the heart cell. This increased intracellular sodium then triggers another exchange mechanism, the NACA exchange, which in turn brings more calcium into the heart cells. And it's this extra calcium that directly increases the force of contraction, making each heartbeat stronger. Additionally, they also stimulate something called the vagus nerve, which sends a sort of calming signal to the heart, helping to slow down the heart rate.
Ah, okay. That makes a lot of sense. More calcium means stronger squeezes. Got it. Now, you mentioned two main ones, digoxin and digitoxin. What are the key differences between them, like how the body handles them?
That's a great question, yeah, because their differences really influence how they're used. So digoxin is more water soluble. That means it's primarily eliminated, mostly unchanged, by your kidneys through urine. This gives it a half-life of about 24 hours or so. Digitoxin, on the other hand, is more lipid-soluble, more fat-loving, so your body's liver has to metabolize it first, and then it's eliminated through bile and stool. This whole metabolic pathway gives it a longer half-life, maybe around 36 hours. Therapeutically, both are used for acute cardiac failure. Often an initial higher dose, what we call a digitalization dose, is given to quickly get the drug level up to where it needs to be, followed by lower daily maintenance doses to keep it there. They're also really vital for controlling the rate in fast, irregular heart rhythms like supraventricular tachycardia and, as I mentioned, atrial fibrillation.
Okay. But with such powerful effects, I'm guessing managing side effects must be absolutely critical with these drugs. They sound potent.
Well, absolutely. That's a huge consideration. The side effects for cardiac glycosides are, well, a major focus because of their potency, and also how closely their effective dose is to their toxic dose. It's a fine line. Common complaints can include things like headache, dizziness, nausea, maybe vomiting. More seriously, though, they can cause cardiac issues, bradycardia, that slow heart rate we mentioned, and various other arrhythmias, which can actually be life-threatening. For long-term use, some patients might experience things like gynecomastia, which is breast enlargement in men, or impotence. And the ultimate risk, if it's not managed really carefully, is severe cardiac toxicity, which unfortunately can be fatal. When it comes to digoxin specifically, its toxicity is a really big concern because it has what we call a narrow therapeutic index, which basically means there's a very small window between the dose that helps and the dose that harms. So careful dosing and monitoring are just crucial. And here's a super important point. Low potassium levels significantly increase digoxin toxicity. Potassium levels really matter here.
That's why if you're taking diuretics at the same time, which often happens in heart failure, potassium-sparing diuretics are generally preferred to try and help maintain a healthy potassium balance. And for severe toxicity, there's actually a specific treatment called digoxin antibody fraction, and antidote. Basically, they can reverse its effects.
Wow, that really highlights how interconnected everything is, like the body's electrolyte balance directly affecting how these powerful drugs work. And speaking of diuretics, they're often used hand in hand with these cardiac glycosides for heart failure, aren't they?
They are indeed. Yeah, diuretics are really a cornerstone of heart failure treatment. They work by helping your body get rid of excess sodium and fluid, which often builds up when the heart isn't pumping well, like in CHF. By reducing this fluid overload, diuretics lessen the workload on the heart, allowing it to pump more efficiently.
Yeah.
So yeah, they often work very well alongside glycosides and other heart meds.
Okay, brilliant. Let's pivot now, switch gears a bit, to another absolutely critical aspect of cardiovascular health. Blood clotting. It's this natural process our bodies rely on called hemostasis. It's designed to stop blood loss when, an injury happens. It's actually a marvel when it works correctly.
It truly is. Hemostasis involves this really precise three-step dance that happens incredibly quickly, in seconds usually. First off, you get vascular spasm. The injured blood vessel reflexively narrows down, clamps down to try and limit blood flow. Think of it like your body quickly, cinching a belt around the wound site. Second is platelet plug formation. Platelets, those tiny little cell fragments floating in your blood, they get activated by the injury site. They become sticky, and they rapidly clump together right at the point of damage, forming an initial kind of temporary seal. And finally, there's the really sophisticated coagulation process. This is a complex chain reaction, a cascade involving many different clotting factors. So for this stable clot, platelets are key for that initial plug, like we said. Then in the coagulation cascade, a really crucial conversion happens. A protein called prothrombin gets converted into thrombin. Thrombin then acts kind of like molecular scissors. It cleaves another protein, one that's normally soluble, called a fibrin, turning it into fibrin, which is insoluble. And fibrin is essentially the molecular glue. It weaves itself into this mesh network, holding that platelet plug tightly together and forming a stable, strong blood clot. This whole intricate process also needs vital cofactors, like vitamin K, thromboplastin, and calcium ions. They all have to work together just right to make sure the clot forms properly.
It's an amazing system when it works right, stopping bleeding, protecting us. But what happens when this natural process goes, wrong? When a clot forms inappropriately, say inside a blood vessel where it's not needed, that could cause huge problems like a stroke or a heart attack, right? So what happens then?
That's precisely when we need to intervene, often with anticoagulant medications. You probably know them better as blood thinners, though they don't actually thin the blood. What these medications do is reduce the blood's ability to clot. They're used once a patient is diagnosed with an unwanted blood clot, or sometimes to prevent clots in people who are at high risk. The typical treatment duration for a diagnosed clot, it often ranges from maybe 3 to 6 months. But depending on the type of clot, where it is, and the person's risk factors, some people might actually need to take these medications for the rest of their lives. It really depends. When we categorize the main types of medicine that prevent blood clotting, they generally fall into 3 main groups, and each works in a slightly different way. First, you have the anticoagulants themselves. These disrupt that complex chemical chain reaction, the coagulation cascade we talked about. They essentially stop the cascade from fully forming that fibrin clot. Think of drugs like warfarin, which messes with vitamin K, a critical factor, or heparin, which boosts natural clot inhibitors in your body. Then there are antiplatelets. These drugs focus specifically on stopping those tiny platelets from sticking together and clumping up in the first place, interfering with that initial platelet plug formation. Aspirin is a really common example here. And finally, we have fibrinolytics. These are sometimes called clot busters. They're really powerful medications, usually given in emergency situations like a severe stroke or heart attack, to actually dissolve an existing dangerous blood clot that's already formed. So you see, each category targets a different part of that intricate hemostasis dance.
Wow. What an incredible journey we've taken today. I mean, we started with the heart's amazing pumping action, dove into the brain's subtle role in regulating blood pressure, which was fascinating, and then navigated the truly complex, intricate mechanisms of blood clotting. It's pretty mind-blowing stuff. And through it all, we've seen how specific drugs are precisely designed to target these systems, sometimes even drawing inspiration directly from nature, like with the foxglove.
Indeed. And gaining knowledge about these fundamental physiological processes, how our bodies work, and the sophisticated drugs that interact with them. It's truly key to being well-informed about human health. The body's precision is just, astounding.
Absolutely. Well, thank you for joining us on this deep dive today. And as you mull over what we've discussed, maybe consider this. It's truly amazing how our bodies manage to clot blood when we need it to, and crucially not to clot when we don't. How does that incredible precision make you think about the genius behind both our own biology and the medicines designed to work so intricately with it? Something to think about.